In this video we're going to talk about Tourettes Syndrome, and here we go. Well, what is Tourettes Syndrome? Tourettes Syndrome, also abbreviated TS, it's a hereditary tic disorder, and really that's what we're going to talk about, this word a lot. And it usually begins in childhood, and it tends to have a male predominance. The male to female ratio is about 3 to 1. And there's a strong family history involved, so it's often inherited. And we're going to talk about this today. Tourette syndrome, what does this syndrome really involve? Well, it involves tics. And the initial type of tics are called simple. And really they involve some of the kind of minor facial grimacing, jerking type of maneuvers, blinking, excessive blinking. I mean, we all blink, but excessive blinking, and even excessive sniffing that can become quite bothersome. And then later these tics progress to complex tics, and those complex tics involve vocal ones, where the person starts making loud irritating sounds, snorting, and then also the person may even start barking or grunting. Oftentimes when you see Tourette's in the most severe form, they have something called coprolalia, and this is actually very famous. Tourette syndrome kind of becomes famous for this because this is a very unfortunate occurrence. It's when the person starts blurting out obscene comments and words, obviously involuntarily. It can happen in about 10 to 30% of Tourette's patients. Another thing that can happen is echolalia, which is referring to when a person repeats something they've just said or something that somebody else has said. Fortunately, the symptoms of Tourette's tend to decline when the person or the child becomes a teenager. So this is what we're really talking about here, is these tics. Well, how do you diagnose this? Well, the diagnosis of Tourette syndrome is really just a clinical diagnosis, meaning the doctor will, you, the doctor, or you, the medical student, will observe the patient and monitor the patient over time and really observe what's going on. Let the person sort of act out these tics. Very rarely, if necessary, a neurologist might do a brain MRI, but it's usually not done in the diagnosis. EEG, these are standard neurological tests. Now we'll talk a little bit about the treatment. How do you treat this? Well, by far the most common medication is clonidine to treat. Now, clonidine, as most of you remember, is a blood pressure medicine, right? It's used to treat hypertension. So why are you giving this medicine to somebody with Tourette syndrome? I mean, Tourette syndrome obviously is a neurologic disorder. Why is a blood pressure medicine being used? What is the reason? Well, that's a good question. I'll try to explain it. Well, first of all, what is the mechanism of action of clonidine? MOA, right? Mechanism of action. And go back to your pharmacology days. It's an alpha. This little symbol is alpha. Alpha 2 agonist. Alright, well, what does that mean? Alpha 2 agonist. I mean, does that have any meaning whatsoever? Okay, well, let's draw a little diagram here to try to explain. Well, most of you remember there's something called a synapse, right? Some of this may come back to you from your pharmacology days. The synapse is in the middle here. Now this is the other neuron, right? So this is the synapse, okay? This arrow is pointing to the presynaptic region, okay? Presynapse or presynaptic region, and this is the postsynapse. Now, in this presynaptic region, you have these little receptors. I'll draw a little let's change some color here. There we go. That's a receptor. Okay, alpha 2 sits here, right? Alpha 2 receptor. Now, an agonist, what's an agonist? An agonist is something that activates it. Now, when you activate an alpha 2 agonist with a medication such as clonidine, what happens? Well, in this particular example, what we're talking about is a neurotransmitter called NE. Do you know what NE stands for? Norepinephrine. Can I fit it in here anywhere? Let's draw it here. Norepinephrine. Okay. Now, when you stimulate the alpha-2 receptor with an agonist, such as clonidine, what does it do? Well, it will reduce norepinephrine release. Okay, that's the big long song and dance. So it reduces norepinephrine release from the terminals and decreases the firing of these norepinephrine cell bodies in the brain. And that research has shown that in Tourette's syndrome, it's the norepinephrine that really is involved in the pathophysiology of the complex behaviors such as tics. Okay, so that's how you treat it. A couple other things I wanted to mention before I finish off this presentation is how to treat comorbid conditions. Comorbid conditions in Tourette's syndrome. There's two in particular I wanted to touch on. There's ADHD and then there's OCD. Okay? Attention deficit hyperactivity disorder can also exist along with Tourette's syndrome, and these are treated with CNS stimulants. Okay, and CNS stimulants are very, very widely prescribed. You have methylphenidate, very, very widely prescribed. And then you have dextroamphetamine, all the amphetamines, very popular. OCD, obsessive compulsive disorder, is also a comorbid condition that can exist in association with Tourette's syndrome. How do you treat that? Well, the treatment of that involves a couple things. There's cognitive behavior therapy. Cognitive behavior therapy basically involves where you expose the patient to the things that they are having obsessions about, and you try to prevent a response. And it's kind of like you make the patient used to these things that are causing them anxiety, situations that are causing them anxiety. Cognitive behavior therapy. And the medication that's most widely used is called clomipramine. It's a tricyclic antidepressant, and it's also used in the treatment of OCD. So there you go. That's a little bit about Tourette's syndrome.